The Omicron variant of the coronavirus is not going away.
No, in fact, the BA.5 subvariant that is now circulating across the country may be the most contagious yet.
It accounts for more than half of cases, with infections surging across all age groups. UW Health's Dr. Bill Hartman joins us. Welcome to Live at 4. Welcome back.
Hi, Dr. Hartman. Good to see you.
Thank you for having me.
Now, people that are fully vaccinated are still coming down with this BA.5. What's going on?
Right, so this BA.5 is distinctly different than previous variants of Omicron, and it's particularly slippery. It's able to evade immunity from people who've been infected with even previous Omicron variants. And so it certainly has been evasive to people who've been previously vaccinated. What we do know, though, is that people who have been vaccinated and boosted still have broad protection against the worst things that can happen from COVID, the severe disease, hospitalization, and death. And so it really still is very beneficial to be both vaccinated and boosted, even in this day of BA.5.
There is a lot of talk about an Omicron-specific booster that will hopefully be coming soon in the fall. So is it better, if you're thinking about getting a booster or if you're eligible for one, should you wait until the fall for the Omicron-specific one, or should you get boosted now if you're in that eligibility group?
I think if you're in the eligibility group, it makes sense to get boosted now. Waiting for the Omicron-specific bivalent booster, as they call it, I don't know if it is going to be beneficial or not. These are the tests that are being run currently, so we can see how effective. We know that you get a good antibody response to both BA.4 and BA.5 with the vaccines, but overall, we don't know what level of effectiveness that's really going to convey, and especially in October when 4 and 5 no longer are with us and new variants arise at that point.
And we don't know what those new variants might bring.
Exactly.
Why is BA.4, why are BA.4 and BA.5 so much more virulent?
So they have a particular mutation within that spike protein that it's not recognized by the antibodies that people have had when they've had previous infection or with our vaccines. And so our antibodies aren't recognizing this as something that they should be attacking as soon as it comes into a person's body. And so it makes it very evasive to the immunity that we have in the community right now. What we do know, again, is that if you have the vaccine and the booster, that you are going to be protected still against the worst things that can happen. But these things aren't force fields right now. And we're still seeing a pretty high level of community transmission.
But COVID now is a lot different than COVID back in March of 2020. We have vaccines, we have antiviral medication. So, I mean, it's still bad, but it's not, hospitalizations are not going up as much.
Right. We are seeing, especially with BA.5 now, a trend of increasing hospitalizations nationwide. But we really aren't seeing a spike in the number of people dying of COVID anymore. So we do have effective means to treat it, whether it's with Paxlovid or some of the monoclonal antibodies. And with one of the long-acting monoclonals, we're able to give pretty good protection to people who are immune-compromised. So we're definitely in a very different place with COVID than we were even a year ago.
And we hear about the Plaque rebound. What is that about?
So that is something that we're seeing. The Paxlovid itself is a 5-day medicine that you take orally. But for some people, and we've seen this more often than we'd probably like, as soon as they stop taking Paxlovid, they feel good for a couple of days, and then they get a rebound of symptoms. It's even happened to Dr. Fauci, who took it. And so it's a phenomenon that we have to look at a little bit deeper. Maybe the course of the medicine should be longer. We don't know yet. What we do know is that it definitely makes the symptoms better, and especially for the people that don't get that rebound, this has been a very effective treatment.
Are you contagious on the rebound?
Right. If you get the rebound, you're not infecting other people, right? It's just the resurgence of symptoms.
It's a resurgence of symptoms. it's likely that you would still test positive, and so theoretically you could still spread it to somebody. But the chances of being infectious, we would think that the viral load would be diminished far enough that hopefully you're not going to be transmitting many people.
Just when we thought we were getting a handle on things. Doctor, thanks for being with us today.
We appreciate
great information.
we appreciate your time so much, Dr. Hartman. Thank you.